What is this? This is Mr. M, who is a 40 years old young man who comes to the clinic and has these complaints of breathlessness. When we ask a detailed history, he says he has been treated for tuberculosis 2 years ago. However, in spite of being declared cured by his doctor, he has been having this breathing trouble, which has increased so much that now even traveling 100 meters is like running a marathon for him. He has to do lot of efforts to maintain his daily activities also. So, what are we talking about? Once we declare a patient cured, or once you discharge a patient from the wards or the ICU, the real journey begins. And this journey beyond may not be very pleasant for many of the patients who are declared cured of their respiratory illness. So, the question is cure enough? What is the life after discharge and cure? We need to reimagine the healthcare beyond survival. Why do we need this? Why are we talking about care which needs to be taken beyond cure? Because the reality behind recovery may not be very pleasant for everybody, and it may be sometimes very grim. Because if a patient is even declared of cure, he is free of his disease, he has taken treatment properly, the organism, the bacteria, the virus has gone away, but breathing still hurts, breathing still continues to be a mammoth task for this patient. Why does it happen so? Because the organism has gone away, but lungs remember the disease, and this memory is not very happy one. It's an unpleasant one, because this leaves behind scars. So, the lungs are getting scars which we call fibrosis. The lungs are getting cavities which we may term as holes when we explain to the patient. The changes remain in the lungs which are permanent. They persist long after the infection clears, and sometimes these changes may also slowly progress, causing difficulty in breathing. The function, it is not only what we see as a damage in the X-rays or in the CT, but it is a functional damage too. What is this functional damage? We all know our lungs work day and night. Our breathing is a very automatic process, but what does lungs do? They take oxygen from the environment, and after this uptake, this oxygen is supplied to each and every living cell in our body. Imagine the lungs are not functioning optimally. This oxygen is not received by the cells as well as the body for body functions, and then one has to work extra hard to get that oxygen, and this is what leads to various symptoms of breathlessness and difficulty which our patient is suffering from. So, survived does not mean recovered fully. Is this true only for TB? No, we have all come out of COVID pandemic, and we have seen that many of the patients or the cases who have been declared cured of COVID within the 10 days or the 15 days or 3 weeks have been discharged from the hospital within 2 weeks, or say perhaps after a long hospitalization also. These few of them also have come up with similar complaints. So, be it COVID, TB, pneumonia or any severe lung infection, the story repeats itself. So, after the cure and when you survive the initial trauma, the road is bumpy. This scarred lung is prone to more and more such infections. So, there are recurrences of infection, there are recurrences of hospitalization and admissions also to the hospital if the symptoms are very severe or the condition is critical. So, what are we looking at? What are we talking about? Yes, we are talking about post-infection lung disease. What we don't see, we don't treat, we don't talk about, but we are now having an invisible epidemic. This is a new epidemic which is hidden beneath the surface. And why is it hidden? We have patients around us. We have human beings, our own friends, our relatives, our patients who have lifelong trust in us. However, they are all suffering from this problem of breathing difficulty, this problem of functional disability in the lungs. And this is, I think, a new epidemic which 21st century is facing. Millions survive, but many struggle to breathe, and this is not rare. This is not an unspoken reality. If we look at the magnitude, what is the magnitude of this problem? Just think, by 2022, WHO said that there have been 360 million cases of COVID which have been diagnosed. Of this, 5 million died. But how many survived? 355 million. So, just imagine that even if a fewer percentage of these people are left behind with respiratory disability, the number is huge. Same is the case about TB. The TB incidence is 10 plus million per year globally. We treat 75% of them. Many others remain undiagnosed. But amongst treated, that is TB survivors, people having post-TB lung disease can have a varied range. This range is wide. It can be as less as 15% to as high as 60%. India alone has the largest burden of TB cases of about 2.6 million. We cure a good number of cases. We have good strategies, we have good drugs, we have good care. But of the 2.3 million cured, if we look over what has happened in this century for 25 years, we must anticipate 35 million TB cases which have been treated. But if we see how many of them are left behind with such trauma, the number itself is huge. Breathlessness is not just a symptom. It tells you about a disease, as well as it also tells you about the way of life a person is leading. It is definitely a social problem. Just imagine climbing stairs appears as if you are climbing Mount Everest. It's so difficult. You have to stop for breath, and this is not a story, it's a reality for these patients. We not only have this as a social problem, but we will lose productivity. Dependence of this person who is suffering on his family, on his caretakers increases. Not only this, it also adds to the catastrophic cost of living alone. Living itself is not a difficulty, but also a added burden, which is a social burden also. The dignity of the person is compromised. Recurrent visits to the doctor and admissions definitely adds to the cost, and a free bed, I believe, is a right. It is a very natural process. The air comes in and you breathe out, you exhale. So, it is not just survival, it is a matter of dignity, it is a matter of right. It is a rightful way to live your life, which I feel every person and every patient who has recovered has a right to. So, when the lives are saved, we should not stop. But what should be done is, we need an honest reflection on at the time where the care ends. That is the time when one must start thinking about which type of life will be offered to this patient. So, what we really need is, we need to work beyond elimination. Having targets and timelines for TB elimination is not enough. We need to allow the lungs which has suffered this trauma to recover. We need to restore life to the fullest as much as possible. We need to introduce rehabilitation, preventive strategies for infection and vaccination, and follow-up care where this person builds up his life slowly and steadily and tries to live it to the fullest. What we need definitely is care beyond cure. But the question is, how do we offer this care beyond cure? We need ideas, we need imagination, we need innovations where we can diagnose a disease quite early. After a complete treatment, we need to identify cases or say persons who are likely to have this damage to the lungs. What can be done for early diagnosis of this damage? What can be done so that this damage does not progress? And the question is, if we cannot stop the progress, can we at least slow it down? This is imagination on one part. What is needed as a care is also, we need trained healthcare workers. We need people who have empathy towards such cases. We all know nobody talks about TB because it does not have glamour. Nobody talks about TB because it has its own stigma attached. But at least after treatment, we must be able to offer empathy. But the question is, do we have experts to deal with this post-TB lung diseases or post-infection lung diseases? Do we have state-of-art chest clinics? Do we have a health system which takes recognition of this problem and start developing some type of model, be it a hub-spoke model, be it offering some advice based on either AI or telemedicine? All these things must come together to offer some solution for the care which needs to offer after cure. So, this is not the end. This is a new beginning where care beyond cure must be thought of. It must be offered and it must be taken up by the patients who are suffering so that they build up their life slowly and steadily but successfully to live healthily and take a deep breath of relief, take a deep breath of joy.